Dr. Siti Nadia Tarmizi. Good morning, Ibu Siti. As always, it is always a pleasure to have you with us on the C Morning Show today, Ibu. And of course,
Good morning, Carol.
Good morning, Ibu. And of course, we're going to jump into the, the discussion that we had today. I have so many, questions.
So many questions on your mind.
Finally, because this is what me and Paul has been talking about. We also asked you in our last show before. Now it's finally here. The second booster shot will focus and will be available first for the health workers. So it seems this is the same repetitive like the first time we got our vaccination.
Correct.
So health worker first, senior citizens, and those that has, comorbidities and whatnot. So with this, Ibu Siti, how long do you think the vaccination will cover all frontliners, and what type of vaccination will they be using for their second boost shots?
Yeah, so I think this is good things, because currently we are aware that the health staff are getting the third vaccine. It was like July 2021, so almost it's more than 6 months, and we know that from the study. If the vaccine has been given for more than 6 months, the titer will be reduced. So in terms of new subvariants and then new variants that coming up, so we decided based on the experience from other country that the health staff need to get a 4th shot of the second booster. So we have like 1.9 million health staff that will going to have the second booster. So we aim to, like previously, we think that within 3 or 6 months, it should be finalized the number.
Okay, so that would be on target for the end of the year. Now, we obviously understand that frontliners and health medical workers are more at risk of getting COVID-19 because they're dealing with cases and patients every day. But what about us? How important is it? First of all, when will the 4th dose or the second booster be available to the general public? And how important is it for people like us to receive it? Because we do know the COVID numbers have gone down. Yeah. Is that going to dissuade people from getting their boosters?
Yeah, first we still monitor the condition. The first one, we still waiting for a survey because currently we don't have yet the study regarding regarding the titer among the community. We have last survey, I think, on the March, about more than 96% of community have already high titer antibody. So we need to monitor whether there is a decreasing of the titer antibody at the community level. Of course, at the individual level, we keep try to increase the coverage. Currently, between the first job and the second job, there is like 30 million people not yet complete their vaccination. So I think this is the first priority that we have to cover the vaccine. And then if we seen the 3rd dose that available for general population, it's still like 55 million people getting the third dose. So I think we need to have more concentrate in achieving the complete vaccination and then increase coverage of the 3rd dose, because it might be the general population is still like 20% getting this 3rd dose. So it's not really urgent decision to get general population for the 4th dose.
We need to catch up first.
Yeah, and I love, Paul, how you imply that us as a public, that when are we going to get our 4th shots? Because, I mean, like me and Paul, Ibu Siti, we're always coming to work almost every day. And we're not meeting different people all the time.
Absolutely.
Now, it's good that you touched base on the booster shot or the 3rd booster shots program now by the government. As you know that, all public places now, it's, they're only allowing, especially with the Peduli Lindungi app, for those who already had their booster shots.
Correct.
So how do you accelerate the government's program on this booster shot? If you can please elaborate on that, Ibu Siti.
Yeah, that's one of the strategy to increase immunity at the community level because of we are aware several weeks we have noticed there is increasing of the confirmation positive cases of COVID-19. Yeah, previously it was like under 100 case per day, but we know that several weeks we are experiencing with like 3,000 up to 6,000 case per day. So we see there is an increase of new cases due to the new subvariant BA4, BA5, and BA275. So with this, we try to again try to have a high coverage on the third booster in order to prevent these new subvariants that might imminence that for the increasing of the number. So again, how we strategize this effort to increase the third boosts. Again, we have make the vaccine center available. We try again in certain area, for example, in the mall, but not all the mall like we have previously when we have
I noticed that. There was a lot more last year.
And then and spatial area, you know, like Citayam Fashion Week, we have
that's nice.
We in those area we have I think the Jakarta already opened this vaccine center or over there. In of course like in Car Friday we have that service too. So besides of course like in the train station or on the airport or on the seaport we have opened this vaccine center. But of course all the health facilities currently, especially for general population to get the third booster, I think they do not need very difficult, but in certain areas such as like Jakarta, maybe they ask the participant before they got come to the health or to the vaccine center, they need to register first. So it might be you check first, but almost in the like Puskesmas, we do not need to register.
Okay, so there you go. That answers my question. I had a question while we were off air. It's easier in some spots than others. Some places you do need to register first. Okay, so let's go back to this second booster, Bu Siti. We said that health workers were covered under this, those with comorbidities, those at an advanced age. So is that everyone that is going to be covered under this new program starting on July the 29th, or is there any other groups that are included in this first wave of those getting their second boosters?
Currently, we are aiming the second booster only for the health worker.
Health workers.
We do not yet include elderly or people with the comorbidity or other condition. Because you already mentioned that the high risk is for the health worker is more than other general population.
Okay.
Now, Bu Siti, I mean, even though we're not a part of the group just yet, but this is going to be our foreseeable futures, right?
Sure.
So, of course, we want to know if we got the, let's say, with the first booster, for the second booster, does it have to come from the same vaccination company or the brand itself, or you can varies?
Yeah, I think the combination for the fourth injection is almost the same with the second, for the third injection or the first booster. So it will be like a combination, and allow any type of or any platform of the vaccine that available in the facility can be used for the booster. So only I think Moderna that need to have the same type for the first booster and the second booster, but others like Sinovac and then Sinopharm or Zivivax or AstraZeneca or Pfizer or Johnson & Johnson, it's can be use any type of the vaccine for the fourth injection or the second booster.
Okay, so what about the time interval, Siti? Because we do know that when those that haven't gotten their first booster need to wait at least 6 months from their second vaccination. Oh, sorry, it was 1 year, right? 1 year after your vaccination.
Yes.
And then you're allowed to get your booster. Now, how long before the third shot and your fourth shot? I'm starting to get all my numbers mixed up here.
Like the
interval,
month,
yeah.
The
How
interval
long?
time between.
What's the minimum amount of interval they can wait?
Yeah, it's still the same. Yeah, the interval between the first booster and the second booster is minimum is 6 months.
6 months, okay.
And then if you or you have has been cured from the COVID-19, you have to wait either 1 month or 3 months after that.
Okay.
After 6 months.
All right.
All right, so Ibu, you know, we're just also very curious. You know, I have a two-question part, if you don't mind here, Paul. Well, the first one, if you got your third booster, it seems like it's 1 and 2, 3 and 4. So 1 and 2 conclude together. So 3, it seems like you're not done yet until you get the fourth. Is it the same way like that, Ibu, or is it a different you know, scheme? And
So one by itself, right?
Yes, or is it by yourself? The third one is by itself, and the fourth one is by itself. Now, and of course, please do let us know. Will this second boost shot really can fight against new COVID variants that is, you know, out in the wild right now among us?
B4, B5, B275.
Like so many numbers.
Okay, so what we call it the complete vaccination is the first one and the second one.
Okay.
And then for the third injection and the fourth injection is we call it the booster. We have such as same scheme, yeah, about the vaccination in the children. For example, if you know that we have like measles and rubella that comes below 1 year old, and then they got during their primary school again for the first booster and the second booster. Or if we remember, we have like hepatitis. Hepatitis have several injections. The first one is the complete one, and then later we have like the third, the second, the third, and the fourth vaccination for the booster.
Right.
Oh, so, okay. Now, okay.
It makes sense now, because if you're a parent and you take, I've just taken my kids to their shots.
Right.
Some of them have to be very timely as well.
Yes.
Like you can't wait too long, or you can't come too early for the second shot either. So again, if we can relate that to COVID-19 on a much smaller time frame, then that would make a lot of sense. Easier to remember. As well. Bu Siti, so how long are we expecting to achieve? Because I remember at one point earlier this year, it was reported that Indonesia actually had this quote-unquote super immunity, because those that had just gotten their boosters and those that have recovering from Omicron as well. And then there was a lot of people that was immune.
Like simultaneously?
Simultaneously at the same time. It just so happened that was the timing. Now, now that the numbers have gone up a little bit again, can we expect to achieve herd immunity with this second booster shot? Is that what we're trying to achieve, and when can we expect that to happen, if it is to happen?
Yeah, so it will be related to the previous question from Carol, whether these current vaccination are able to prevent from the new subvariant of COVID-19. Of course, we know that the WHO and the SAIDS, the International Immunization Committee, has been studying this, and currently all the vaccines still effective against all the subvariants. But it will be not enough only come from the individual immunity. So we heard about when we started the COVID-19 vaccination about how to make the herd community. So it currently that has been processing right now about how we have a like high coverage of the individual vaccination. But again, at the community level, we need to achieve the target, because when we achieving the target, at least like 70% of the population got vaccination, the herd community will be coming up. So that's those things combined, that how we make sure that these vaccine are still strong enough to against the new subvariant of COVID-19.
Right.
And then regarding your question, Paul, about whether the super immunity will coming up, of course, first, now we have a survey. We currently have undergoing survey to monitor whether there is a decreasing of the immunity among the community level. We do hope if this number is not, we did not find very low, I think it's still fine in order to have the strong herd immunity among the population. But again, the homework is we need to prioritize to have a complete vaccination. 70% of the population should complete their vaccination, and then we need to have increasing our coverage for the first booster.
Yeah, I think that's the only way to know for sure, right? I mean, we cannot rely on people just recovering from COVID. You know, oh, I guess they're going to be immune for 6 months.
Right.
We have to make sure if at least we've covered enough ground, at least we know enough people will be immune at the same time.
And also the new things or trend is coming out with the rebound of positivity that has been coming up now. I know. Hey, maybe I want to ask about that, Ibu Siti. I mean, there's maybe not here in Indonesia yet, but we've covered some news, and right now President Joe Biden is going through that situation right now. Rebound of positive result. What happened there, Ibu Siti, if you can enlighten us on that?
I think that's not been have the answer of the question, because the COVID-19 is a very new disease, So we did not really understand how it's worked, But if we seen the COVID-19 is not only getting infection, but they are affected to our immune system. So I think that's the way why some people going have relapse, and then some people within a few days after they get negative, and then like 2-3 days they get positive. We don't have yet the answer, but at least what we know that with the vaccination we have very less symptoms, and we don't have a high death, or even we do not need to have a hospitalized.
Well, actually, good thing you bring that up, because that brings me to my next question, where we've seen transmissions rising again, numbers are going up for positive cases, but bed occupancy rate still remains relatively low compared to what we've seen in the past before. What does that tell us, Ibu Siti, about what we're experiencing with COVID-19?
Yeah, as we know since the beginning, the vaccination have very reduced in terms of hospitalized and the death cases. And currently with the quite high coverage, although it's not yet 70%, we've seen it happen. So many people got infected with the new variants, but it's very less symptoms, and then the duration is very short compared to the previous situation. So this is again the advantage of the vaccination. We got protection in terms of severe symptoms and the death situation.
Maybe we're just getting stronger too, because I've heard that from my friends that have gotten it. They're 3, 4, 5 days, and they said, I'm in the clear this time compared to like in the past, where it's taken up to 2 weeks or maybe even more. So who knows? Maybe we're slowly winning this.
And we know that the only way to protect ourselves is the vaccination, and we keep on telling that every day in our show too, because we felt the benefits too ourselves that already got the first, second, and also the third booster shot. Now, Ibu Siti, I think you are the right person for Paul and myself to ask about the current situation with the new variants. We have the BA4, BA5, B275 now, with the name as Centaurus. I mean, I'm like bewildered with everything, right? So do you have any more factuals about regarding on this new variants, or is there also new variants coming up that maybe we should be aware of, Ibu Siti?
Yeah, the first thing that we are know that the 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 variant is might coming up for the COVID-19 because the type of the virus of the COVID-19 is mRNA. This type of mRNA virus is the one who really always try to mutation in terms of to adjust with the situation. Yeah, so we know that I think if we seen from the genomic test, there is like more than I think already 70 subtype or subvariants of the COVID-19.
Oh gosh.
So I think it's the mutation always happen in mRNA virus. So we will see this COVID-19 getting more and more and have a new variants or have new subvariants. But again, not all the variants or the new variant is strong enough to make infection. Sometimes if we learn with the mutation, it make the virus it's getting weak. So again, of course, we need to prevent by having vaccination. And then secondly, while this virus is getting mutated and then might be the mutation getting weak, it times that the virus cannot infect it to the human again.
Yeah,
and looking forward for that.
If you think only this year alone, we haven't seen much new variants, but we've seen more sub-variants.
Right.
So variants of the same one, Omicron. Yes. So, and again, if you want to take a silver lining to it, Omicron seems to be the lighter one compared to previous ones in the past. Right. So it seems like people are recovering quicker, and that's perhaps helping the situation a bit. So finally, Bu Siti, in regards to these boosters, is it still safe for everyone then, as we have in the past? And we'd like to remind our viewers as well, those with any sort of comorbidities, pregnant women, and perhaps anyone who is breastfeeding?
Yes.
Yes, I think the recommendation from Itagi is still the same, yeah. Okay. And then with the current number of people getting vaccination, I don't think people need to think about this vaccine is safe or there is an issue with, when we have like the first vaccination in 2021. Yeah. Right. So I think we know that like 428 million people already got the vaccination, either the first injection, the second injection, the third injection. So it's quite a lot of people already experiences with this vaccine. So we do hope there is no doubt about this getting this vaccine. Some side effect might be happen in some people, but again, we don't really have a severe side effect up to now.
That's good to know.
Thank you very much, Ibu Siti Nadia Tarmizi. Of course, it's always great to talk to you because you cleared a lot of notes, a lot of questions that hasn't, that we have in our mind, and of course, good, many success, and also for the fourth booster for our health workers.
Yeah, good luck with the rollout.
Yes, thank you very much, Ibu Siti. You have a great one. Stay safe, Ibu.
Have a great week.